Welcome. Thank you so much for joining us today as we talk with our Assuaged public health team about addiction and shopaholic tendencies. So that is really exciting that we get to be able to cover this topic today. A lot of people, especially during the pandemic, are just out there buying a lot of stuff, and it could be something that you're not realizing as a habit. So we're here to educate you about that today. So next slide. I believe I'm covering the first slide. All right. The addiction is a choice. There's two types of addiction, and in that is substance addictions and process addictions. And a substance is going to be an addiction that is of a drug nature or alcohol nature, whereas process addictions are getting a high, like an emotional high, when you're going and gambling and you're spending money and eating, when you're getting satiated from the foods that you eat. A lot of people tend to indulge in fast food because it gives a fast feeling of pleasure after eating it. So those are, and that also includes process addictions, which could include sexual activity. So that is that. Does anyone have anything to add on that? Mm. And Luna, are you covering the next slides? I don't see Indu's transcript of who was.
Okay, I think I have to do that, so it's okay. Um, so now I think we're going to go more into what addiction is. And so addiction can be classified as a chronic disorder involving the repeated use of drugs or engagement in a certain behavior. And as Cynthia was saying, those behaviors could be, things like spending money, eating, and it basically creates that feeling, whereas drugs is some sort of substance. Addiction can be influenced by biological, psychological, social, and environmental factors. So biological could be like your genetic disposition to addiction. Psychological could be, just like how your brain works. Social is like your environment and your peers and people around you. And then environmental can be like also the people around you, but, where you're growing up, the presence of drugs, that kind of stuff. Also, genes affect the engagement of these behaviors and the degree of reward an individual experiences when using a certain substance. And so basically, some people are more genetically disposed to these addictive behaviors, because a lot of people can practice some of these behaviors, such as alcohol. However, if you have the genes to make it addictive, then you might have more issues with alcohol. So how does addiction work? So it's an appetitive behavior. So when an individual is exposed to a certain addictive behavior, that generally will start in your teenage years as you're starting to get more freedom. It can also be there's mood enhancement involved, and that's basically, so after you have tried that addictive behavior, you're going to find some sort of pleasure from that behavior. And then so following that mood that you get from the behavior of using that addictive substance or that behavior, there's learned association. And so this is more like the psychological effects of it. And your brain is basically trained to realize that if I do this behavior, I'm going to feel good, or and you're just going to want to start using, these drugs or whatever behaviors. And then once you learn these associations that, oh, these drugs are going to make me feel good, you will become attached to this behavior over time. And it's going to be easier to, keep up with it as you practice that behavior more and more. So I have a video. I'm not sure if it's going to work. I'm going to just try to play it. So just let me know if you guys can hear it. And then if no one can hear it, I will just share the link to the video in the chat.
So I just noticed, so it says, Sam, that you're going to go next. So Indu, you're actually posting comments publicly, so on the private chat. That's why I was getting confused earlier. I was like, "Where's my slides?" But we're all here
Oh,
learning.
sorry about that.
No worries. So Sam, you're covering the side, love.
The one after
This video
the
is
video.
not audible. This video is not audible. Yeah.
Okay. So I think what I'm going to do, I'm not sure if I can share this publicly, but I'm going to send you guys the link, and then maybe Cynthia or Indu, since you guys can share stuff publicly, this is just a link to the video. But basically the video just kind of explains how the brain works with drugs and also just like natural rewards, and it kind of shows how the brain, you know, is kind of tricked into thinking that like drugs and stuff are more natural things. And so like, you know, addiction is a psychological process. It's not like it's something that, you know, people have no control over, or people have control over all these.
Did you want me to share the video?
Yeah.
Okay, let me do that. Application window. All right. Boy, this is definitely a learning process. Oh, I see here. So I got it. I had to open a new window. Must be Mercury in retrograde or something. Technology is crazy today. Okay, there we go. Can you see the screen?
Yeah.
Awesome.
Deep within the brain is a set of structures called the limbic system. The limbic system contains the brain's reward circuit or pathway. The reward circuit links together a number of brain structures that control and regulate our ability to feel pleasure. Feeling pleasure motivates us to repeat behaviors. When the reward circuit is activated, each individual cell in the circuit relays electrical and chemical signals. The small gap between the sending and receiving cells is called the synapse. In the reward circuit, dopamine neurons release the neurotransmitter dopamine. The released dopamine molecules travel across the synapse and link up with proteins called dopamine receptors on the surface of the receiving cell. When dopamine binds to the exterior of the dopamine receptor, this causes proteins attached to the interior part of the receptor to carry the signal onward within the cell. Some dopamine molecules re-enter the sending cell via dopamine transporters and can be re-released. When a reward is encountered, the presynaptic cell releases a larger amount of dopamine in a sudden burst. Dopamine transporters will then quickly remove the excess. Dopamine surges in response to natural rewards help the brain learn and adapt to a complex world. However, drugs are able to hijack this process, contributing to unhealthy behaviors and consequences.
That was very informative. Thank you guys so much for sharing that. Okay, I got the slides back. I'm learning how to use the software. We're having fun with it. Okay, are we ready to go on to the next slide? Awesome.
People of all backgrounds and beliefs can experience addiction. It can be difficult to understand why some people are more prone to it than others. Regardless of your upbringing or moral code, many factors can raise your risk for addiction. So genetic factors contribute to about half the risk of addiction, and this could include family history, epigenetics, and if someone is prone to mental health issues such as depression or anxiety. Psychological factors include stress, mental health, and trauma. Social factors include using drugs, practicing addictive behavior at a young age, and availability of substances among family and friends. And environmental factors are exposure to traumatic events and an individual's surroundings. Some risk factors may be more powerful than others at certain stages in development, and an important goal of prevention is to change the balance between risk and protective factors so that protective factors outweigh the risks. And so for the models of addiction, the moral model was introduced in the 18th and 19th century. Addiction was viewed as a sin, and drug-dependent people were considered morally weak. The punishments were physically brutal, and people could even face jail time or were put in the mental hospital. For the disease model, it assumes the origin of addiction comes from within a medical viewpoint. Addiction is either present or it isn't, and there is no control in the intake of a given substance, and the disease is irreversible. For the psychodynamic model, this one originated from Sigmund Freud and explained that the drug may be an unconscious response to problems in childhood trauma. So people can link these problems to their childhood and how they cope as adults. For the social learning model, anyone who engages in an activity that they find pleasurable is at risk for developing a dependence. Dependence exists in degrees, and it is a normal factor of human behavior, and many want to engage in a behavior they know one shouldn't. Addictive behaviors are only terminated when the individual makes the decision that cost outweighs the benefit, and it is also behavioral and social in nature, not just chemical. For the social cultural model, this one links substance abuse to the society that the individual lives in, and socially and culturally disadvantaged groups are more likely to experience drug abuse. Lastly, for the public health model, it identifies 3 key factors and the relationship between the agent, the host, and the environment. The goal is to reduce harm of addiction by primary, secondary, and tertiary prevention. For example, for primary, this ensures a problem does not happen in the first place. For example, community development, drug education, and media-based strategies. And for secondary, the problem is identified in early stages and intervention is applied. For tertiary, this is when the problem is serious, where people would turn to counseling or hospitalization. And for the DSM model, which is the Diagnostic and Statistical Manual of Mental Disorders, this is the handbook used by medical professionals in the US and around the world as a guide to diagnose mental disorders. This contains criteria related to description, symptoms, and the diagnosis of mental disorders. This manual is for universal adherence and language for further research studies and development of medications and intervention tactics. And the DSM-5 recognizes substance-related disorders resulting from the use of 10 separate classes of drugs. As you see listed on the slide, it is alcohol, cannabis, hallucinogens, inhalants, opioids, stimulants, tobacco, sedatives, hypnotics, or anxiolytics. Sorry, I don't know how to pronounce that. And caffeine or other unknown substances. The rewarding feeling that people experience as a result taking drugs may be so profound that they neglect other normal activities in favor of taking the drug. The activation of the reward system is similar across substances in producing feelings of pleasure or euphoria, which is often referred to as a high.
So there's a number of symptoms to look out for substance addiction, and some of these include intense urges or the need for the drug, needing more of the drug over time to get the same amount of the relief, increasing dosage over time, spending money on drugs despite your financial issues, avoiding responsibilities, work and social life, continued use of the drug despite harm, driving or doing other activities under the influence, and failing to stop using the drug, and also experiencing withdrawal when attempting to stop taking the drug. Okay, one example of a behavioral addiction is gambling disorder. It's an uncontrollable urge to keep gambling despite the negative consequences. Gambling stimulates the brain's reward system, so it releases the dopamine, which leads to the addiction. It's the most common impulse control, and it can result in relationship, legal problems. People with gambling disorder, they often forget about like the responsibilities and like day-to-day life. They're just very fixated on the gambling. Some symptoms of behavioral addiction include becomes an obsession. The behavior becomes frequent, such as like daily or more than once a day. The person chooses to engage in the behavior instead of other activities that they that they once enjoyed and did in the past. Relationships are harmed because of the behavior. Many treatment centers ignore the substitution behavior addiction for a substance addiction, and abstinence is not possible for some behavioral addictions, such as food, sex, exercise, and shopping. Okay, and then these are some other behavioral addictions. It's not recognized by the DSM-5, but it causes distressing conditions and occur to be treated professionally, such as exercise addiction, food addiction, internet addiction, love addiction, porn addiction, sex addiction, shopping addiction, which will be reviewed in the next slide, and then tattoo addiction, video game addiction, and work addiction.
So then going for shopping addictions, which is a newfound thing with all the online platforms that are coming for shopping and everything. I mean, you have different windows open on your PC, and like you are not just closing but just going back and again. So I think like this mind, like like it's getting so used to this online shopping and all that. So even before online stuff, like like shopping has been an addiction for quite some people. Once they see the sale, like they cannot resist going to the shops. So like those kind of addictions we are talking about. So when it becomes compulsive, and when it goes beyond your means, say like like some people I have seen, like one of my students, like like who overshops. I mean, she knows her salary is only 2,000, but she will go beyond that. And so it affects her finances, her family's finances, and it leads to a lot of relationship problems. But like people have to understand there is something called a compulsive shopping disorder. So like I don't know whether like this is like this will come under DSM, but still like like there is this compulsive shopping disorder which we should be aware of. So some people may not be able to control their shopping behavior. So it often occurs in the presence of other disorders, so anxiety, the OCD, the obsessive compulsive disorder, the personality disorders, and everything else. So for some people, like like they want to just forget about their negative feelings, the traumatic feelings that they have undergone in life, and so like that's why like they are just going into that. So maybe like through counseling or through awareness or the psychoanalytic therapies, like we need to make them aware, cure them, like of their negative feelings. And so like like this automatically heals. So we should be aware of all this. Yeah. So how can we help someone with an addiction? So similar to other addictions, like like shopping disorder, also we need to be educated. Once we know like it's a disorder and people are not doing out of like like their ignorance, or like like they're not doing it to just harm anyone else, but still it's becoming a habit for them. So they are not able to stop it. So educate yourself. And also the caretakers, they have to take care of themselves. They should not ignore themselves and take care of the person who is addicted. Like that actually like spoils the game, because the other person is not aware, and you also fall into that loop. Like it becomes very tough for people. So like the self-care is very important, especially for a caretaker. And we have to express love and concern to those people, because we cannot look down on them, because they are just doing it out of their control. I mean, like they are beyond their control. So like we have to be supportive to them. Of course we should have some boundaries, like for the person I'm talking about, like that person, like like they just reduce that shopping limit for a day, because it cannot like bother the family so much. So all these measures we can take, practical measures, but still we should be loving them. Like we cannot like look down on them. So all those things we can actually get them for some treatment therapies. A counselor can help them, a psychotherapist can help them, a psychologist can help them. So we should get help for them also. So we need to understand it's an ongoing process, similar to other substance abuse, similar to the obsessive compulsive disorder, and all other addictions and mental disorders. These things also undergo relapse. So once they like get those flashbacks of those past trauma and everything, they again resort to these kind of shopping disorders. Okay, so we have to be very, very careful in like addressing this issue and like like be supportive to them. So that's very important.
Awesome. Can we, does anybody else have any input to add to that slide? We had some breaking up. And I'd like to kind of cover what you guys think. Sorinda, what do you think on this slide? Can you give a narrative?
Yeah, so basically what she went over was just helping someone with an addiction. It's just important to be very patient since it is a sensitive topic to talk about with someone that has a addiction. So just by expressing love, concern, offering treatment while also being caring for the person is very important.
Awesome. Thank you so much. Let's move on to the next slide, and lots of learning here. Right.
So similar to other mental health disorders, we have resources for addictions, including the shopping disorder. So we can go into like the national helplines, like the substance abuse, mental health services administration. You have the helpline for that, and you have the National Institute of Mental Health and the drug abuse. So you have all these numbers over here, which we find across Google. So we can find this help. And, like we have to support our loved ones. And even we have these problems, we have to go to these numbers and get help. Like there is a road to recovery, and we should be, like availing all this help. We should not waste these resources, but use them, like to just outgrow all these disorders and, like come out clean and, like lead a very happy life. So now, like we are opening up for the discussion. We are actually like going to discuss on the various discussion questions that we are having, and also like we are going to receive comments from our viewers now, and also people within like the presentation. So we're going to discuss across about our thoughts and ideas on like the addiction and shopaholic tendencies. Is there any personal experiences? Like do we have any new methods of dealing with this? Is it a new found disease? Is it a myth? Like all these things we are going to discuss now. So let's all participate in the discussion. So I want to go ahead with like the first discussion question of this presentation. So does addiction last a lifetime? That includes a shopping disorder also. So can I ask my teammates, like, do you think addiction lasts a lifetime?
So I'd say that in a way, it's kind of yes or no, because I think there's definitely ways to get out of it and not be actively addicted to stuff. However, it's a process and there's stages of it, and so even if you're no longer using a certain drug or doing a certain behavior, you're still in the process of recovering from that addiction, and you still may be technically addicted to that product. So it's a long, I mean, it's something that lasts a very long time, and I think in a way it lasts a lifetime because you will be managing that addiction your whole life. However, there are ways to, get over it and, be sober and safe and healthy, even if you have that addiction.
That's awesome to hear. Sam, do you want to go ahead?
Hi, I also agree with Luna. I feel like this really depends on the person and their maintenance of their habits in recovery and whether they want to keep it up or not, or whether they fall back into bad habits or their old habits. So I feel like this would be different for case by case for each person and depending on how committed and strongly they feel about getting rid of the addiction.
Exactly. So does Surinda have anything to say for us?
Yeah, just to add on a little bit from Luna and Sam, addiction is definitely a process. So it depends on if the individual has like resources or also the support of the family. I think that's important also.
Yeah, that's a key, actually. Yeah, you're right. So, this is actually a Harvard topic. The Harvard University have actually, researched on this topic. So, what they say is, there is nothing called an addiction personality. We are seeing interventionists who had not been, clean. Who had habits, who had these substance abuse and everything, but they have come out of that and they're able to heal people. So, similar to other sufferings, when we say in life, you are having a suffering because, like, you want to understand the sufferings of other people. Similarly, like a substance abuse, works on the same note. Somebody who is addicted, who is able to overcome that, can teach the same way for other people to know it. I have worked in the halfway homes where, the supervisor who had been an addict before knows where these buddies will, will stay, how they get access to all these drugs again, how they undergo relapse and everything. So, like, he's a best healer over there. So, this is a myth to say that someone holds an addiction personality. Of course, we have the genetic predisposition. Of course, we have the reward pathway and everything, but still, we can actually overcome an addiction and live a very clean and happy life. So that's what I'm coming in. So the next thing is, does it last a lifetime? No, it doesn't last a lifetime at all. Because once you are clean, you are always clean. I know one celebrity who had been, like, blamed that, after he had come clean, he had actually consumed wine. Is it okay to consume wine and all other those things? Yeah, perfectly fine. Not at all a problem. Once you overcome addiction for one particular thing, it's equally, it's applicable to all other addictions. And by statistics, they say, when you are coming out of an addiction, 50% you are not going to fall for the relapse, nor like you are going to get addicted to some other thing. And previously we had the Alcoholic Anonymous. We had some theory stating that, addiction is a lifetime thing. No, it is not at all. It is not a lifetime thing. Once you have overcome, you can be completely clean and you can lead a very happy life after that. So it's really special to just go for that. So, this is not a lifetime affair at all. So, people can be rest assured that, you can be clean and you can be having a very happy life hereafter after overcome your addiction. Yeah.
Awesome. And this is Samantha.
Hi, so for the next discussion question, we'll be talking about what are the 5 stages of recovery. And here we have a quote that says, "There is no person walking the face of the earth who demonstrates more courage, dignity, honesty, and integrity on a daily basis than an addict in recovery." And this is from Drew Edelman. So I'll begin and talk about the first 3. So the first one is in pre-contemplation. In this beginning stage, most addicts have not yet admitted to themselves that they have a problem. The majority of addicts continue going through the motions of using or drinking due to internal or external pressures in life. And the severity of the situation is often unknown to the person and will try to avoid the topic as a whole. And this includes bringing up the topic themselves or avoiding people that may bring up the topic to them. And they are often in the state of denial until they no longer can deny their addiction. This stage is also what people may often refer to as rock bottom, as you may hear is a very commonly used term. For contemplation is this stage is once the problem has been recognized, the addict has accepted that changes need to be made, and then they're most likely still struggling to understand the root causes and questions how to move forward. The using or drinking may continue, but the addict will find less joy in it, and feelings of hopelessness will increase. Typically, during this stage, the individual begins to think more about sobriety, and when feelings of anxiety and excitement begin occurring, then they are ready to move on to the next stage. And then third stage is preparation, and during this phase, the feelings of excitement become stronger, and the person begins to make actual plans toward their own recovery. And this can involve abstinence or even going to rehab. This stage is all about preparing for recovery and making a plan to accomplish it. So if anyone else want to talk about the next 3 to 6 stages, then Go ahead.
Okay, I can start with action. So action is basically when you're starting to take those initial steps. It's the physical process of taking concrete steps towards your recovery. It involves changing these certain behaviors or environments that involve your addiction. During this stage, the addict's confidence will start to build, and their feelings of accomplishment will also build because they are making those steps, to recover from their addiction. And they will be starting that strong foundation for long-term sobriety. This stage takes the most effort because you are actually taking that action and making those big changes to become sober. And you're forced to look inward as an addict and be introspective. So once your feelings of satisfaction are developed towards your progress and over recovery. And then I think someone else might go over maintenance.
I'll cover the maintenance. So the maintenance after treatment, the recovering addict must work to maintain their recovery. Continued healing must always be a priority because it can be very easy to slip back into the grasp of addiction. Recovery addicts must apply the coping strategies they learned in rehab to their everyday life and establish a daily routine and practice dealing with triggers. Yay. So lastly, on the termination side of things, the final and ultimate goal for the 5 stages of recovery is termination. This change symbolizes change when a person with substance use disorder no longer feels threatened by their substance of choice. At this stage, they feel confident and comfortable living life without substances and fear relapse less and less every day. So,
Yeah, these stages are pretty very informative. I loved the discussion. So this is very informative for us. So we have all these stages, and so all these relapses also undergo the same kind of stages. So we may need to be consistently helping that person who is undergoing all this substance abuse and addiction stuff, because once they become clean, they are going to be completely clean, and we are going to have a very comfortable and happy life after that. Yeah, thank you so much. So can
we have another slide. Let's see. So 20. Serinda, are you handling this one?
Yes. So the next discussion question is how to support someone with their drug addiction recovery. So these are listed, but do a few of you want to pitch in some ideas first?
Support comes in so many different forms, and I know a lot of addiction addicts are lacking the kind of support and structure that they need to overcome the addiction. And so it's important that we don't judge them during the process of them adjusting to making healthier habits. So there's got to be actionable items in that. So creating a substance-free environment, actively listening and understanding and not judging. That's going to allow the addict to overcome certain barriers involving addiction. So support groups are amazing, because you could relate to other people that have gone through similar circumstances of addiction. However, in some cases, people, they may be introverted or, socially awkward. They may not feel comfortable going out there and involving other people into the experiences that they've had. So a lot of people can be guarded and shut off. So it's all about finding out what, they might feel more comfortable in a private group setting online, opposed to going to a physical group. But yes, patience is involved in all of that, and just giving your love and support is going to allow someone with an addiction to get through that.
Yeah, absolutely. I would love to add, since we said that is like an association between the negative feelings and the negative trauma. Like when family and friends like become the reason for that, the addicted person is going to resort to that addiction again. So let's be very careful to not add any negative things to them. Trust them completely. Like I have seen some family members who have been saying, oh, you can never change. These kind of attitude, like it will spoil the, like, the recovery process of the addiction person. Like all our efforts combined together, especially the caretakers. From the caretakers, like, like I would choose the significant people. We call it the significant other in counseling. That person has to be very careful in uttering a word, like in having an attitude towards that person, because um, they lack something, the trauma or something, like they have a lack in something, that vacuum. They are filling up that vacuum with, like, like this addiction and everything. So, like, like we need to be very careful in not adding up to their negativity, but like add a lot of positivity in their life. Yeah, the family makes a lot of sense here.
Awesome. Samantha, do you have anything to add to this slide?
Yeah, I agree with a lot of the tips that were listed on the slide, but one other thing besides the ones that we just talked about is possibly just the way that you talk to the person and treat them. For example, like not like using your comfort as a threat or a weapon for them to quit. So, for an example, like as a dialogue, like to tell the other person, like if you really cared or loved me, like you would quit your addiction, and basically making them feel even worse about it. And like rather than say that, we should try using words along the lines of I love you enough to see you get better, or I care about you enough to see you live in a situation where if their addiction was life threatening. So to just change the dialogue and intention of using or showing your love as unconditional rather than conditional. Thank you.
Surrenda, what do you think?
Yeah, all of those were really good points. It's very important to keep in mind how you word things, honestly, because if you don't word it correctly, it could just go the opposite direction. And another important thing is to encourage healthy habits, because drug addiction, in a way, is a habit that has been developed, and it's like something like a routine almost. It's like a daily thing for some people. So it's important to substitute those habits with more healthy habits, such as taking time to exercise, eating healthier, anything that makes your body feel great.
Awesome. Luna, what do you think, love?
The one thing that I wanted to add is I think addiction, along with a lot of other mental illnesses, it's like they are an actual illness and discrepancy in the brain, and so they do need to be treated as such. Like it's pretty much the same as a lot of physical illnesses. It's just in your brain, and so it can be really easy to have a stick around it and be judgmental around it when it's just an illness. It's just harder to see because it is in the brain. And I think one of the things is addiction is not it's not generally a choice. I mean, you can make choices to get out of it, but that is very difficult. So just I think, as a lot of us were saying, is just being, showing unconditional love and support and helping them get that help is really important, because this is something that generally will need professional help, as it is an actual mental disorder.
And one of my friends, like, who runs a de-addiction center in Malaysia, so like he suggests, like, like he actually projects those celebrities, because we love celebrities anytime. So we love to follow them, we love to see them, what they're doing and everything. And there are some celebrities who help us with their past histories and how they have overcome all these addictions and everything. And so he used to project those celebrities and, like, like show the youngsters especially and how they have overcome and how they have prospered in life. Because somewhere, like the addicts, like the substance abuse friends, they lack this self-esteem and the resilience to just come out of it. They think like they have to be in that whirlpool of life, but we have to show them, no, your life can be different. That's what we can show them. And celebrity life can help doing that. Yeah.
Awesome. So let's go ahead and go on to the last slide here.
So this last slide, it kind of just shows some cool addiction recovery tattoos that we found. So yeah. So as you can see, the first one says, "My chains are gone." I can't read that other word, but it says something set free. And so these are just different tattoos that people have gotten after they have their recovery, and I think they're really cool. It's also, something permanent that you can put on your body, and I think that might, help people be accountable and also just show their strength in getting over the addiction, because as we were saying, it's one of the hardest things to get over. The second one says, "We are made strong by what we overcome." And that's super true, I think, especially for addiction and other things. So if anyone else has anything to say, that would be great. But otherwise, I think this is our last slide.
Yeah. Go ahead, love.
No, in my place, like I have seen beach parties, the people with these kind of tattoos, they just come and encourage people, like that they can live a very addiction free life, like that's what I want to share. Cynthia, please go ahead.
Yes, this has just been really an awesome show for, learning about what kind of addictions play into also, Shopaholic, and how we covered how that can affect someone's life. Addiction comes in multiple forms, and so it's just kind of up to us to identify if we are suffering from an addiction and the steps that we could take to pull ourselves out of that. Because sometimes, like I was mentioning earlier, there's a lack of support and understanding among family members. So healthier habits and eating healthier foods and tapering down from prescription drugs and doing stuff in stages without doing it cold turkey, so to speak, uh, is really a wise thing to do, because I know for myself, I have gone through a lot of different addictions throughout my life. I had almost gotten a second DUI at one point. So during that time, I had to realize, okay, I'm taking 15 daily prescription drugs. That's an addiction. Drinking alcohol, that's an addiction. So how do I break away from that? And the best way that I was able to do that was going plant-based and tapering off the drugs and taking responsibility that I was going through an addiction. So, Luna, did you want to stem on anything on that? I think, or sorry, not Luna.
Sure.
Luna, you just covered everything, didn't you?
Yeah. The only thing I would add is I think Cynthia did a good job of talking about, like trying to pay attention to like yourself and all of that. But I think one thing is like paying attention to your loved ones and your family members and just trying to see if you can see the warning signs, before things go out of control. And so just paying attention and loving your family.
Awesome. Samantha, what do you think, love?
For my final thoughts, I definitely agree with what Luna said, and I feel like that although people with addictions may have destructive behaviors, it's important to treat them just like anybody else and not make them feel bad or worse about the situation that they're already in. And I feel like that supporting them to the fullest that you can is very important, especially just showing that you love and care about them could possibly encourage them to want to get better for not only themselves, but for the people that they love as well. Thank you.
Awesome. Thank you so much. Surrenda, do you have any final remarks, love?
I think everyone covered most of the points, but I just wanted to end with it's important to keep in mind that not everyone works the same, as in like for the recovery, like one solution might not be the best for everyone. So it is a process and it will take time.
I love that. Wonderful. Well, this has been a great show with the entire team. I think we covered some very valuable points here. We have taken our live videos and we're turning them into video contents and podcasts. So stay tuned for all of that. It's really exciting as we're growing and learning during the process and advocating on matters involving public health. So thank you for joining us, and we will be seeing you on Friday. See you later. Bye, guys.
Thank you.